another edition of Health Connections, the television program that connects you with a healthy way of living. I'm your host, Hunter Reno. November is American Diabetes Month. Did you know that diabetes is one of the leading causes of disability and death in the United States? It can cause blindness, nerve damage, kidney disease, and other problems if not controlled. Moreover, 1 in 10 Americans has diabetes. That's more than 30 million people, and another 84 million adults are at high risk of developing type 2 diabetes. To explain more, I'm joined by Dr. Eugenio Aguera Serrano, endocrinologist at Larkin Community Hospital. Welcome.
Hi, Hunter.
What is diabetes?
Diabetes is a condition that is a metabolic disease that is reflected in an elevation of blood glucose. It also is a disease that confers risk for multiple complications and even heart disease.
And what do you find is causing diabetes?
If the person has type 1 diabetes, the cause of the diabetes is destruction of the cells that make the insulin by antibodies that the body makes, and we're not sure why that happens. We know there's a certain risk involved. There's genetics. If somebody in your family has type 1 diabetes, you inherit the risk for the diabetes. When the antibodies develop and they destroy the beta cells, or not enough insulin is made, and then that's why the person develops diabetes. And usually that is seen in younger patients, usually it's kids or adolescents, but it can happen at any age. Then type 2 diabetes, which is the most common type of diabetes, that's the one where you have insulin resistance. You don't respond to the insulin that the body makes. So in that case, you do make insulin, but your body doesn't respond as it should, so your glucose is going to be high as a result of that. That type of diabetes can be treated initially with just pills and diet and exercise, and eventually may require insulin, but it is something that just progresses with time.
What are the risk factors for someone who's diabetic?
Risk factors for diabetes, the first one is genetics, your inheritance. So you have any family history of diabetes, that confers a risk for diabetes. That's the same for type 1 or type 2. Now for type 2 diabetes, if you become obese, that actually increases your risk of getting diabetes. There's a direct link between obesity and diabetes. So a person who has family history of diabetes and also becomes obese increases their risk of developing diabetes.
Besides types 1 and type 2, are there any other types of diabetes?
Yes, there actually are other types of diabetes that are less common, but they can be seen as well. For example, a woman who may be overweight or obese can develop gestational diabetes. And that's the diabetes that happens only during pregnancy. The problem with that diabetes is that the risk is there for permanently developing diabetes. So the woman may go through her delivery and then have no diabetes after delivery of the baby, but then they can develop diabetes later on, and there's in fact a 50% risk over the next 5 years of developing diabetes permanently. There's other types of diabetes that are called secondary diabetes, and these are diabetes that happen when certain unique situations occur. So for example, a patient may have chronic pancreatitis, chronic swelling of the pancreas because they're alcoholics. Because the pancreas is swollen, it's damaged constantly, that leads to less insulin production, and they actually develop diabetes as a result. You also have patients who may have pancreatic cancer, for example. Their pancreas is removed by surgery, and they develop diabetes because they have no cells that make insulin. So those are less common types, but they can be seen as well.
Which ethnic groups are prone to this disease?
Diabetes affects all ethnic groups. Everybody's at risk of developing diabetes, but there are certain ethnic groups that have a higher risk. So in the United States, American Indians have the highest prevalence, about 50% in some of the tribes. Then Hispanics are the group that have the next highest prevalence. That's followed by African Americans, and then the Caucasians are the next group.
How can diabetes be diagnosed?
There's 3 different ways of diagnosing diabetes. You can have a fasting blood sugar done 2 separate times, and if the sugar is more than 126 2 times, that diagnoses diabetes. Another way to diagnose diabetes is to do something called a glucose tolerance test. The patient is given a very sweet liquid to drink. They have the blood drawn fasting an hour and 2 hours after they drink the juice that they're given, and then they're tested. If the sugar is over 200 after 2 hours, then they are safe to have diabetes. Another way to diagnose it is to get something called a hemoglobin A1C. That's a test that we typically measure in diabetics, and it gives a 3-month average of the glucose the patient has. If that number is more than 6.5% 2 times in a row, that diagnoses diabetes as well.
What are some of the complications related to diabetes?
Diabetes has various complications that can happen. There's acute and chronic complications. Let me talk first about the acute complications. Some of the acute complications are like symptoms that you would have about diabetes. For example, blurry vision is something that can happen as an acute complication of diabetes. That's because the sugar is going up and down, and that's affecting your eyes in that sense. You can also get symptoms of hypoglycemia or low blood sugar when you're taking certain medications for diabetes, and that's an acute complication as well. Chronic complications are far more serious, and they take longer to develop. It can take up to 10 years for complications to develop in some individuals. The eyes are affected. Something called the retina at the back of the eye can become affected. If that is damaged, you actually can go blind. So it's important that the patient have screenings, and every year they see the ophthalmologist to make sure the retina is okay, so they can be protected from developing blindness. The kidneys can also be affected, and you can actually end up on dialysis if your kidneys are not working properly because of the diabetes. You can also have heart disease. Strokes and heart attacks are the primary cause of death in patients with diabetes. So these are very important risks and complications that can happen with the disease. Another chronic complication that can happen is that you can lose sensation of your feet, or you can even get a sensation of burning or tingling that can happen in your legs or your extremities. And that's because the nerves are being damaged, something that we call neuropathy. That is something that can be prevented also. All of these complications can be prevented if we do take care of the diabetes though.
What can be done to slow the complications of diabetes?
Essentially, you need to do your diet and your exercise. You need to control the diabetes properly, and you need to go see your physician and take the medications that you're given. All the medications are different. They work in different ways. They can be combined to control the sugar in a more optimal way. What you want to achieve is a hemoglobin A1C of less than 7% at least. That is pretty good control, and with that percentage, you are protected from developing complications, or at least they're delayed. If you can get even lower, like 6.5%, that's even better, but that's not for every patient that's out there because it has a little bit more risk of developing low blood sugars. But definitely controlling the sugar better is something that's very important, and diet and exercise are very important as well. Eating properly, avoiding certain foods, and the exercise that you have to do will help. Exercise doesn't mean becoming an athlete. A lot of people hear the word exercise and they think that suddenly you have to become an athlete, and that's not what you have to do. You just need to at least walk. If you walk for at least 30 to 40 minutes every day, that makes a big difference. You're gonna lose weight, you're gonna feel better, and your sugars will be better controlled.
What is the prognosis for a person with diabetes?
Unfortunately, people with diabetes die sooner than people who do not have diabetes. They tend to live between 6 and 7 years less than somebody without diabetes. And this is because of the complications of diabetes. Now, if you don't take care of your diabetes and you get complications, let's say you have a heart attack or you end up on dialysis, your lifespan is even shorter. So it's very important to control it properly so that you have a better life. Also, quality of life is very important, and controlling the diabetes gives you better quality of life as well.
Can diabetes be cured?
Unfortunately, we do not have a cure for diabetes. We do have a lot of good treatments now that help control it very well. And these drugs actually protect you from the complications of diabetes also, but we cannot cure it yet. There is no cure, unfortunately. Research is still ongoing, and hopefully we'll find some way to cure it. But there are newer treatments that are quite effective at controlling it. In fact, there's a new drug that is being studied right now that can control up to 90% of people who have diabetes. And that's very good because that protects you from developing complications.
What is Larkin Hospital doing at the moment in reference to diabetes?
Larkin Hospital actually has a training program for endocrinologists. And I run that program, so we're training young doctors to be specialists in diabetes so they can go out to the community and help take care of diabetics. In fact, many of the graduates have actually stayed in the state of Florida, and so they're helping taking care of patients with diabetes in the state.
Thank you, doctor.
Thank you, Hunter. It was my pleasure to be here today.
Remember that prevention is always your first method of defense. If you experience constant urination, thirst, hunger, weight loss and fatigue, nausea, vomiting, and blurred vision, please visit your doctor. A health professional is the best person to diagnose diabetes. And to learn more about Larkin Hospital's diabetes program, please visit larkinhospital.com or call 305-284-7500 We're taking our first break, but when we come back, we'll give you some tips on healthy eating for people with diabetes. And later on, we'll teach you which exercises are best to control diabetes. Stay tuned.
Start your story at MDC.
Be analytical. Be imaginative.
Be a rising star. What's your story? Be MDC.
Welcome back. A good plan of diet and exercise can manage diabetes. This segment will focus on the best diet for a person with diabetes and what foods to avoid. We will look at exercise on the next segment. Now I'm joined by Dr. Andres Callafa, professor at Miami-Dade College Medical Campus. Welcome. Thank you so much for joining us.
Thank you for having me.
So let's talk a little bit about diabetes and how diet affects it. How does the blood glucose levels affect a patient when they wake up and after meals?
Well, ideally, the base for treating diabetes and actually for preventing diabetes is to have a healthy diet and also have an exercise program. What is recommended is to exercise every day, at least 30 minutes. And I'm not talking about like heavy exercise, but walking fast for 30 minutes every day is a good exercise for keeping blood glucose levels between accepted parameters. Okay. And we recommended to do it almost every day, at least five days a week.
And how does diet play into that?
Well, a healthy diet based on fruits and vegetables, and also a lot of grains, and help with to keep a body weight between acceptable limits. We need to try to avoid simple sugars. We also need to try to avoid fat because that increases blood glucose levels.
Now, does the diagnosis of a type 2 diabetes mean the patient will have to go on insulin?
Not everybody. A type 2 diabetes initially is treated, like I said before, with diet and exercise, and then you can keep that regimen and keep a good blood glucose level. As the time passes by, most likely the patient may need to have some medications, and we start with oral medications. And as time passes by, the patient may need to receive insulin after 15, 10, 20 years. But with good exercise, a good diet, and also keeping the pills every day, then the person may keep the blood glucose under control and never need to use insulin.
Can they actually reverse their diagnosis of type 2 diabetes?
The answer is not. I mean, initially, if you are recently diagnosed, you may lose a lot of weight and change your exercise, and your blood glucose can go back to normal. But regaining weight and limiting your exercise will bring diabetes back to your body. So, and once it's established, it is not possible to get back to a normal level.
How does alcohol play a role for someone who has diabetes?
Well, alcohol, a patient with diabetes can drink alcohol in the same recommendation that the general population. In other words, if you are a female, you should not take more than one heavy drink a day. And if you are a male, up to 2 drinks a day. So, because alcohol per se, it doesn't increase blood glucose levels. The alcohol doesn't need insulin to be breaking down. But excessive alcohol can cause hypoglycemia and can also, if you mix it with, let's say, pineapple juice or orange juice, then that increases the blood glucose level. But alcohol itself does not affect glucose level as long as you take it with moderation.
So for our viewers, what would you recommend are good travel foods for people with diabetes?
That is an excellent question. Pre-planning is the key. If you know that you're going to travel, pack yourself a nice snack, basically a small container with fruits, maybe a whole grain type of bread, mini pretzel, 100 calories a snack, fruits, and plenty water. That is the key for traveling.
Now, you had mentioned tablets before. Should a diabetic patient always carry glucose tablets?
Well, it depends on what type of medication you're taking. There's a group of medication that can decrease your blood glucose level. In that group, we have the sulfonylureas. That is a medication that increases the production of insulin by your body. So if you're taking that kind of medication, it's not a good idea to be without eating for a long period of time. Sure. So in that case, you should have sugar pills in case that your blood glucose drops
lower.
Mm-hmm.
Now, why is it okay to eat fruits when it's full of carbohydrates, and yet some fruits are better than others? I know that this confuses me for sure. You know, what are the good ones? What are the bad ones? And
well, all fruits have sugar, but it's good sugar. Mm-hmm. Okay, so and it's recommended for a healthy diet. Yes, there's some fruit that contain more sugar than others, but in general, they also have nutrients that you need as diabetics, and also they all have a little bit of protein. So all diabetics need to have a certain amount of carbohydrates a day, and that is a good source for carbohydrates and sugar. Now, there are some fruits that are better in terms of caloric content. I would recommend all the berries. As part of a healthy diet. Strawberries, raspberries, blackberries, even kiwi is a good fruit for diabetes.
Is it true that complications of diabetes can be delayed and even prevented? So we kind of touched on that in the beginning. So in addition to diet and exercise, you know, what other adaptations can individuals make in their lives to improve their current diagnosis?
Okay. Basically, complication of diabetes appears when your average of blood glucose daily is very high. So again, the key of having healthy life and preventing complication of diabetes is exercise and diet. Mm-hmm. So as long as you keep exercising, your body processes the sugar better, mm-hmm. and then the complications are delayed.
Wonderful. Doctor, thank you so much. It was incredible to have you, and I think we've learned so much.
Really
appreciate you being here. For more information about diabetes and prevention, please visit diabetes.org. We're taking our second break, and when we return, we'll give you some exercising tips for people with diabetes. We'll be right back.
Story at MDC. Be bold. Be connected. Be the solution. Be ready. What's your story? Be MDC.
Welcome back. As mentioned before, a good plan of diet and exercise can prevent diabetes or maintain your glucose levels at a normal rate. But if you have been diagnosed with diabetes, what exercise options do you have? Noemi Zaharia, Aquatic and Fitness Center Manager at Miami-Dade College North Campus, will tell us which exercises are best for people with this disease.
Hi, thank you, Hunter. Well, welcome to the Aquatic and Fitness Center at Miami-Dade College North Campus here. We're going to show you a couple of exercises that are beneficial and help reduce your risk for diabetes, okay? We're going to start very easy, very smooth, just to kind of get you going. A nice little aerobic workout, which is cardio, is the best to kind of get you started, okay? So one exercise is actually using one of these bikes. We're going to have Kent here starting to pedal. That's one way. It's more the reclined bike that you're able to use, maybe a more comfortable seating, especially if you have any knee or hip little difficulties. It's a little less stressful on your joints. So it's a nice way to kind of get you going and start paddling a bit. Doing 10, 15, 20 minutes, slowly building it up, it'll be perfect to kind of be able to do it. All right? So Kent, let's move on to the other bike as well. You can, if that's too comfortable or maybe not your cup of tea for the bike, a great way to get going is go to the traditional bike. And then again, start pedaling like that. It's a great way to start at 5 minutes if you haven't done much, and then build it from there to 10 minutes, 15, 20 minutes. If you're able to do that, it's a great way to get your heart moving. A nice little cardio is perfect to kind of get going. And from here, I'm gonna show you one more machine that we can use for cardio. All right, so now we moved up to the elliptical. This is a great way, again, the same cardio workout. You're able to move not just your arms, but also, your legs, also your arms. You really incorporate that. You're able to start getting your upper body involved in a great movement, great exercise, getting more of a complete body workout as well, okay? And from here, I think we're gonna go to the traditional walk, which will be great for you to do outside with our beautiful South Florida weather. In case you want to stay more in an air conditioning situation, the next best thing is using the treadmill. So let's go to the treadmill. Great, so now we're gonna move to the treadmill as promised. Here you can start walking nice and slow first at your own pace, get really comfortable, and then you can start playing with different programs that the treadmill offers. You can actually be able to control how difficult it is as you're lifting it up. As you can see, Kent right now, lifting off the treadmill, so making almost like climbing up on a little hill. And also you can increase the speed that you're walking at. And then you also ultimate goal, which if you can do it based on what you're able to do, and start running. Maybe a nice little jog first, and then get into a nice little run. Again, start nice and slow, and then build it from there, going up from 5 minutes to 10 minutes, and then also increasing the speed and the difficulty of what you're doing. So here's a great cardio workout, as I said, from nice smooth bike to actually getting into the treadmill and walking, jogging, and all the way up to running. And now we're gonna move from the cardio. We also need to work on a strength workout. Work our muscles, upper body, lower body, and our core. So what we're gonna do, let's go over there to the free weights so I can show you some great exercises there as well. Come on, let's go. All right, so now we're done with the cardio. As promised, we're moving to doing some free weights, working on your muscles, really kind of getting your whole body engaged. So I have right now Kendra and Robert Spear demonstrating some great exercises. So we're gonna start with some nice arm lifts up forward. You can start one arm at a time, just like Kendra's doing, or you can do both arms in the same time, okay? It depends on your strength, depends on your fitness ability, kind of where you are, where you're starting. And of course, start at home nice and light. Use some light weights, some small dumbbells, and then you can work your way up to 5, 10, 15 pounds or even higher if you're ready for that, okay? So these are one of the things. The other exercise, which is great, is working your chest muscles, just lifting your arms up, okay? And keep your wrists and elbows strong, and just really make sure, and most importantly, make sure you keep breathing, okay? So as you do this, don't rush through it, don't go fast, just nice and smooth, and just keep working on these exercises, okay? And then we're gonna have one more that they're gonna do. You can actually do it sitting down. You can use the different benches, okay? And either sitting somewhere, it's a nice way of doing almost like a bench press, but without actually the big bench or the big heavy bar, just using the nice dumbbells, and then you can just lift up from the chest, working on the shoulders, and again, engaging your upper body after we've done all that nice cardio, working on the legs, okay? Just always the idea is to be in control. You can just do straight up, okay? Like Robert Spear is doing, or you can have the way Kendra's doing it, as she's turning her arms around, really working all sides of her shoulders, her chest, her back, and just kind of moving on from there. All right, so once we're done all this, what we're gonna do now, we're gonna move into doing some other exercises using some free weights, again, that you can start doing at home, and then when you get comfortable, you can start moving in a gym and get up the heavier weights to go for. So let's go, come on. All right, so now we moved into the fitness room. This could be also your middle of your living room, okay? So we did a nice little cardio. We worked on our arms. Now let's do a little legs and a little abs, okay? Our core that we need to work on. So one of the great exercises Kyle's gonna demonstrate is doing a little bit of squats. You can start with doing with a medicine ball or something lighter. Again, the idea is to keep your back as straight as you can, okay? Go straight down and up, all right? Watch how your knees are, don't go too far back. Keep your legs nice shoulder apart. Just get comfortable, get into a rhythm that works for you, okay? Now, if you wanna get a little more challenge, you can get some dumbbells that you used before for the arms, and you can do the same thing. You can hold the weights next to your body. You can hold them up by your shoulders, okay? Different ways you can do it. Again, be nice and controlled. Don't rush through what you're doing, all right? So these are different squats you can do. You can also do some lunges if you want, but again, depending on your hips, your knees, just be careful what you can and cannot do. Don't do the step too big. Again, be in control. Make sure you keep your balance. All right, that's the big one. Make sure you keep your balance and don't forget to breathe. All right, thank you, Kyle. So let's move down and work on our core a little bit. Nice, simple sit-ups that we can do. We can do without any weight. Let's start with that. And then slowly we can add on to the medicine ball that you can hold. So we can do just a regular bend your knees up and down. Again, be in control. Both ways going up and down. Don't rush through it. Don't yank on your back of your neck, just nice and smooth, okay? So you're gonna grab the medicine ball. Let's show them that as well. Same idea, go hold the medicine ball around your chest and you go up and down. You keep working on that core. Another great exercise to work maybe more on the side muscles here for your abs is doing some nice little twists. This is the hardest way of doing it. You can start first with your legs down, and then you can get a little more fancy, a little bit harder by keeping your legs up and twisting back and forth. Okay, and that's where you start with a nice and easy one, and then you can go how Kyle just did that before, legs up. Okay, a little more challenge. All right, now for the ultimate challenge, if you want to really work on your core, planks are the best because they really work your whole body and it gives you a nice little challenge. One, make sure you're really warmed up. Two, you're really ready for it, okay? Keep your body nice and straight. Don't forget to breathe. Elbows are right underneath your shoulders. Keep your body straight. Don't let your leg down or don't have your up in the air. Just keep it really like a plank, nice and straight. Try to hold it, start with 10 seconds and then increments from 10 seconds up, build it from there. Try to hold it and again, breathe, breathe, breathe. All right? So thank you, Kyle. These were just some exercises we did for the core again. Start at home, start nice and easy, and then build it from there. Come to a gym here at the Aquatic and Fitness Center at North Campus. We have the best staff ever. They will help you through it, they guide you through it. We have some great exercise ideas, show you how to use different machines if you want to get ready for that. So just come on down, let's start working out. So Hunter, I hope this was a nice little addition to talking about how we can prevent diabetes through exercise. So I'm throwing it right back at you.
Thank you, Noemi. Remember that if you experience any symptoms discussed in the first segment, please consult your doctor. Only a healthcare professional can diagnose diabetes. If you need more information about diabetes and prevention, please visit diabetes.org. We hope you enjoyed and learned from this television program produced by Miami-Dade College's Medical Campus and MDC-TV to inform our community on health prevention. Remember that prevention is the name of the game. I'm Hunter Reno. Thank you for watching. Have a healthy day.